I think we'll. Hi, everyone. It's the top of the hour and we are live. Thank you for joining today's discussion. If you can hear and see us well, can you give us a thumbs up in the chat box and also let us know where you're tuning in from, and then we'll get started. So I'll wait a couple of seconds to make sure that you all can hear us. Awesome. Thank you, Caleb. Great to see you. See? All right. Sounds like, or looks like everyone can hear us. Okay, perfect. Eric, thank you for letting us know that you can hear us. Awesome. All right. So my name is Ashley William. I am a proud member of the Junto Health team. I'm excited to moderate today's discussion. And today I am joined by Ken Cahill, who's the co-founder and CEO of Silvercloud Health, and Carissa Chen, who leads strategic partnerships at Quartet. Ken and Carissa, thank you for joining us today.
Thank you for the opportunity.
Thanks for having us.
Yes. So I'm excited for us to, dive into today's conversation. We'll be discussing the impact of Silvercloud and Quartet's work, the challenges of early and mid-stage mental health companies, what they experience and how to navigate them, and then finally questions and considerations that payers, providers, and investors should have when evaluating emerging mental health companies. So lots of grounds to cover, but before we dive in, I would just want to quickly address some housekeeping items. We want this panel to be as interactive as possible. So I'll be moderating the conversation with our two panelists, but I want everyone who took time to join today to engage and contribute to the conversation. And you can actually do that in two ways. So we have a few polls that are live and just eagerly waiting for you to respond to them. So take a look at them at the bottom of your screen. We'll be looking at the poll responses throughout the conversation. So if you can start responding to them now, that would be ideal. And then there's also the Ask a Question box where you can submit questions for the panelists to respond to. If there is a specific question, or if there's a question that you want to address to a specific panelist, I just ask that you write the person's name in there so that I know who to direct the question to. And then finally, there's a call to action button, that green button at the very bottom of your screen. If you're a founder in the mental health or mental and behavioral health space, and you're interested in being featured on our Junto Health Founder Features, these are interviews that we do with founders and we share them with our investor network. If you're interested in having that opportunity, complete that form. We are 1,000% founder friendly. I'm a founder myself. My colleagues are founders, so you can trust us. So yeah, complete that form if you're interested in having one of those interviews with us. We'd love to have you be a part of our founders in the healthcare space, our community of founders in healthcare space. So now that we've addressed all of those housekeeping items, I want to pivot back to our amazing panelists, Ken and Carissa. Again, thank you for making time for this conversation. And I'm sure that all of our attendees are eager to hear more about you, your companies, and your approach to mental health services. So to start, I'm going to give each of you the floor to introduce yourself, your company, explain your role before we dive into the questions. And just to get us warmed up, before you tell us anything about your role or your company, I want to know, we've all, or many of us who have the privilege of working remotely, have gone through this weird transition of trying to figure out how to be productive at home, not in the office. So before you kind of go into your background and your role and tell us more about your companies, we want to know what has been your favorite place to work from home. And get started with you, and then we'll go to Ken.
Got it. Ashley, you might have just cut out for me. I don't know if you tossed that to me or Ken, so I'm going to ask.
Oh, sorry. I tossed it to you, Carissa.
Perfect. All right. Well, then I'll kick it off. Hi, guys. I'm Carissa. I lead strategic partnerships at Quartet. And for me, I am in sheltering in place on the Upper East Side of New York City in a one-bedroom apartment. So I don't have many options for locations of where's my favorite place. But my husband, when this all started, built me a standing desk right outside our window so I can kind of look out and see like Queens to my left and New Jersey to my right. So that's helpful just because sitting down gets a little, I get antsy very quickly. So that's my favorite spot. And I am working on a lot of things and leading strategic partnerships, one of which is actually with Silvercloud. So stay tuned for more of that. But at Quartet, our vision is that every person would get the mental health care they need. And we know that it's really, really hard for patients to find mental health care. And so Quartet's here to make it easier. You know, if you've tried to look for mental health services for yourself or friends or family, you'll know what I mean by that. You know, for me personally, I was trying to help a friend find mental health services as recent as last week. And I was just reminded of why we exist. You know, we're here to help patients in their journey. We are a tech and services company that is a holistic solution for mental health. So I'll kind of hit on it from different stakeholder perspectives, but sometimes I like to describe Quartet as a mix of predictive analytics, a referral tool, care coordination, and care collaboration. From a patient's perspective, we take the lift and burden entirely off of them to find a mental health provider that takes their insurance, that lives nearby, and we offer them, you know, different services, both in-person and digital care. So that's how we're, you know, meeting patients where they are and getting them to care. Most of our customers are health plans who know that focusing on mental health care is not just the right thing to do, but it's the smart thing to do. And so they partner with us to ingest and analyze a large sum of their data. Our data science teams then identifies patients that are high need and would benefit from mental health care who might not know or might not be getting treatment right now. And we engage those patients. Ultimately, working on, or helping patients find preventative mental health care upstream is going to save medical spend down the line. And then to wrap it up, for our providers, for our primary care physicians, as well as other case managers, care team members, we equip them with a tool to match patients to care, knowing that they don't have a lot of time or resources to be able to spend that with a patient. And so they can refer them to Quartet and know that we'll take it from there. And then for our mental health providers, we are a source that helps them grow their practice by sending them referrals, tailored to their specialty. And then our platform actually enables our mental health providers and PCPs to interact and collaborate as well. So that was a lot, and I'm excited to dive into different parts, but essentially we're just here to get patients to care.
Nice, I love it. Thank you for breaking that down for us, Carissa.
Of course.
So over to me. My name is Ken Cahill. I'm the CEO here at Silvercloud, proud to be. So Silvercloud is a digital mental health platform. So we enable healthcare organizations to be able to provide and offer easier, earlier, and more effective access to behavioral health, to mental health care. Be they payers or providers, or indeed large corporate organizations. We deliver across a range of the acuity spectrum, and also a range of kind of therapy areas. So from your well-being side, which would be challenges around sleep, stress management, through to kind of financial worries and mental health, which is a big challenge right now, is the first area. Second area then is the core challenges around interventional problems like depression, anxiety, panic, phobia, fear, and then into the chronic disease side of the house, which is looking at the comorbidities between a chronic condition and mental health challenges that exist so very readily today. We're a spin out from well over a decade of research into the area of how can you deliver digital access with the kind of, if we look at the challenges, the barriers that are there in terms of rollout, they are, low client or patient engagement, high client or patient dropout, and limited clinical improvement. So how can we address all those to make it very compelling and measurable in terms of results? Vision and mission for us. Vision is effective mental health care for all. Mission for us is to help people improve their mental health through technology. We've delivered the platform now to about 475,000 end users, patients, clients, depending on what your term is. We prefer the term clients. Since 2012, with about 40,000 coming on board per month right now. So we'll hit the 500,000 mark in the next 2 weeks, which we're really, really excited about. That's a quick background on myself. Kind of have spent, kind of grew up in what I would refer to as a medicalized home or family. Mom was a nurse, midwife, and dad would be the longest surviving kidney transplant patient in the British Isles, 36 years, which is amazing, still with us. So kind of grew up around healthcare of a sister who would be challenged with some mental health issues. So grew up around kind of those kind of challenges and the effect on the caregivers and the family and the community and everything else that's there, and grew up around technology. So love the idea of being able to combine both technology and healthcare together to really deliver at big scale, big impact. And the great thing about digital delivery, it's so infinitely measurable. It really is, in terms of the impact, the ROI, the outcomes, all the way through to the patient satisfaction that you're delivering. So thank you for the opportunity.
Of course. Thank you so much, Chris and Ken. Thank you for sharing. So we're going to dive right into the first question. So your companies, both Silvercloud and Quartet, are using new methods to solve problems that have always existed and continue to persist. So what have been some of the challenges that your companies or that you have had to navigate and continue to navigate as healthcare or mental health startups? I'll start with you, Ken.
I think, as you say, it's mental health is such a long running challenge. And myself and Chris were only talking about this a little while ago, which was, the challenges that we're going through right now with COVID-19 are putting huge mental strain on everybody across the spectrum of society. I'm really bringing the conversation into home in terms of the challenges that were there. If we cast our mind back to 6, 9, 12 months ago, a conversation, it might have been comfortable to have a conversation with somebody about you feeling stressed. But now I feel you can comfortably have a conversation with somebody about feeling anxious. So, if there is a very small benefit, if such a thing would exist in what's happened, it has lowered the stigma level around mental health during the challenges right now. But, the challenge for, running a business in what's happening right now is demand is very up, in terms of significantly up. But we're also challenged as an organization with 70 people on board, where they're challenged in terms of productivity because they have family members and there may be, multiple people working in the household, and, they're trying to get space and time for the day to be able to, compete and lead on the mission and vision that we have at Silvercloud, because they all care about what we do. So you kind of have this perfect storm of heightened demand, challenge of delivery, challenge of execution on it. So that's kind of one of the biggest issues that is taking a lot of time right now.
Yeah. And I think I couldn't agree more with the stigma has been an old problem. It continues to be, but I think there's a lot of hope right now and understanding that there is a lot of benefit for mental health services. So I view that and claim that right now in this season for mental health care. Another one that I would bring up is, for so long, especially in the US, mental and physical health care have been divided. Let's say 30 years ago or so, when outpatient mental health care was becoming a thing, so much of mental health benefits were carved out, and insurance companies, didn't have visibility, nor did they manage care, and thus you had misaligned incentives where you had companies who were really focused on trying to drive down the cost of mental health spend, even though we know now that you sometimes need to spend towards mental health care in order to reduce, a multiplier of cost on the medical side down the line. And so with Quartet has really embraced that challenge, kind of entered it with our payers, and we partnered with really innovative health plans that are trying to get a lot smarter around what does it mean to manage care holistically, what does it mean to measure quality of mental health care, of getting to know their providers in network, of paying for digital care, which is, innovative for them, trying to figure out payment models to pay for something like a Silvercloud. It's a really exciting time to kind of be part of that bridging process of knowing that, for so long, mental and physical health have been viewed separately, not just philosophically, but also systemically. And so we're trying to combine that now as an organization.
Yeah, and I think it's really interesting to kind of think about that cost multiplier. And for a lot of people, one of the great examples would be something like diabetes, which is a relatively normalized condition at this stage. But the cost multiplier, when you bring mental health into the fold there, with a prevalence rate of about 45% of people who have diabetes will have clinical levels of depression, anxiety, or stress in any given year. So almost half. And the cost multiplier is about a 7.5x increase in cost of care delivery for that population because of the mental health challenge. And it makes perfect sense when you kind of sit back and look at it. It's challenges around anxiety with guilt and shame, sexual health, communication with your clinician, all those big issues. So for me, mental health is the key to unlocking so much of healthcare. I remember reading a report by Safeway Health a number of years ago, and they essentially said 70% of all healthcare costs is behavioral health related, and kind of linking mental and behavioral health together for a moment. But it really does feel that way. If we can provide easier, earlier, quality access to mental health care, the benefit and the ROI, and I understand health systems are challenged right now, but the benefit in terms of hard ROI is very, very significant also for payers and indeed for corporate organizations. This isn't just a discretionary spend or a nice to have or an innovation or even just a customer differentiation. This is, a huge swing back from the carve outs that Carissa was talking about, where mental health was carved out. The ability now to deliver at scale, better access, earlier and easier, push and pull, both the end user wanting this type of access, this becoming the new norm is exciting.
And so I want to build off of what you both are just sharing just now, because my second question is going to be, how is this integrated model of both primary care and mental health care, how does it definitely, you just spoke perfectly, Ken, about the business benefits and like the ROI for the payers and the providers, but how does this model benefit also patients and the providers themselves?
Yeah. I think tremendously, as I mentioned, when you step into the world of a primary care physician, they care about the patient. They're trying to scan for and examine things across many different therapeutic areas, and they have 10 minutes maybe with a patient to really engage with them. But many PCPs know from training or from, kind of staying up to date with everything that oftentimes underlying mental health conditions do exacerbate their physical health conditions, but they don't have the time. They don't have the time to engage a patient, to treat them then and there. And on top of that, even if a provider were to seek out mental health care for a patient, it's often a black box to be able to find a provider for them or to find digital resources for them. And then, so they kind of send them off and say, call the number on the back of your insurance card. And then if a patient goes or not, they don't know. They don't know if a patient were able to engage in that kind of care on a longitudinal basis. And so what Quartet is trying to do is to bridge that, and to say, for a PCP, they can refer a patient to Quartet, but we'll let them know. We'll keep them updated, on that patient's care journey. They might be engaged in both a digital care option like Silvercloud with Quartet or, with a therapist as well. And we put these providers in touch. We also are not idealistic. We know that PCPs and therapists are not spending all day chatting with each other. They're very busy. But what we've done is to really facilitate structured updates. So notes that we know are the types of updates that a therapist would want to provide a physical health, provider that may come up in an appointment, and vice versa. So, we've seen from studies like the impact model that co-located care and collaborative care is certainly what's most beneficial from, cost or clinical effectiveness for a patient. So we're just trying to scale it in a tech-enabled way through that type of collaboration.
Thank you so much, Chris.
Absolutely agree, 100%. So if you put yourself in the primary care physician's office in the positions they have, and exactly as Chris has said, if they even have 10 minutes or 11 minutes with the patient, but then you think about the arsenal, what do they have that's available at their fingertips to be able to deliver in terms of care? It's probably a script pad. And not every patient wants to go down that path, and not every physician wants to bring a patient or end user down that path. So the arsenal is limited in terms of what they can offer. They're restricted in terms of what they have to report back to the plan or the payers in terms of what's there. So they're caught in between two rocks essentially. Integration of digital health within the primary care's systems. Inside the digital formulary, inside of that, ability to be able to prescribe access easy and in an early way is obviously important. We then look at kind of the likes of referrals. So when they do refer out, do they lose contact, as Carissa exactly said, and that results in patient leakage? and kind of don't know. They've sort of sent them out, and do they fall between two stools? Because between 30 and 50% of all primary care referrals to face-to-face therapy never make that first appointment. And that's a huge percentage of, essentially, the primary care physician felt they were doing the right thing, referring them out, but then they lose contact or lose access. And that may cause that patient or client the next time to be maybe a little bit slower about presenting or coming to.
Thank you for explaining that, Ken. I want to just quickly pivot to the polls. We've got a few responses. Encourage anyone who's just joining to take a look at them. But this poll that I'm going to call out kind of seamlessly transitions into my next question that I'm going to direct to Ken. So the question that I have here is related to barriers. We asked, in your opinion, what's the biggest barrier to seeking behavioral or mental health services? And so far I see high cost. The three options here are social stigma, high cost and inefficient insurance coverage, and then limited options and long waits. And right now, high cost and inefficient insurance coverage seems to be leading with the votes. So Ken, I want to ask you, what are some of the barriers that patients often experience or encounter when seeking behavioral and mental health care, and how is Silvercloud specifically addressing some of those barriers that they experience?
So the challenge around high costs, I would actually agree, is a huge, huge issue for people. So around 35 to 40% of therapists in the US do not accept any form of insurance. So that means it's out-of-pocket pay. Time with a therapist, a kind of 45 to 50-minute session, will be between $150 and, in Manhattan, will be about $400 per hour. Twice a month, over an 8-month period of time, that's a huge cost and burden, financial burden for that person. I think there's multiple layers under that in terms of stigma and challenges and wait lists and issues that are there. So the cost, the burden of cost is huge. The access is huge, and the wait list challenges that are there. The amazing thing about digital delivery is that it's essentially almost instant access. Silvercloud can be utilized, be it as a standalone intervention, a standalone delivery method, whereby in terms of acceptability and suitability is able to deliver across a very high percentage, but 82 to 85% of patients who are diagnosed with say, depression and anxiety would be suitable to go through a path with Silvercloud. Where it's maybe an escalation path is required, with partner organizations we work with here in the US, what they're saying to us is providing access to Silvercloud was a holding pattern to bring the patient into face-to-face care and therapy. And also when they brought them in, it was like they were going to session 5, insofar as their ability to articulate the challenges, the problems, and get to the core issues that they had. So digital is my ambition. My hope is that in the same way as you ask the generation now and even the next generation, if they think back about Blockbuster Video, they would say, well, why did we do it that way? And that's where I'd love to see Silvercloud being seen as, well, why did we do it that way? Absolutely. There is, of course, suitability in terms of face-to-face escalation management and being able to deliver care that way. But by stratifying, because what's challenged now is that everyone is coming into a filter or a funnel at the same time, and that clogs up that system. By being able to stratify and deliver those who would be most suitable for digital delivery now, and those who would be more suitable to face-to-face therapy, delivering it that way, is the only way we can tackle the current challenge and even the challenge that the last number of weeks has caused going forward as well.
Thank you, Ken.
Absolutely.
Oh, Carissa, did you have a response? Yeah,
I was
jump right
in. Yeah, because, for Quartet, we've actually been able to offer Silvercloud to some of our patients recently as well. And I would say that there are other ways that their particular modality also speaks into and addresses some of those other barriers. I know high cost definitely being one of the top, but stigma, other social determinants, or just patient preferences as well. I think about stigma, and Quartet definitely plays a role in normalizing the conversation and education and, thought leadership conversations and all that. But one particular way that's been really exciting about our partnership with Silvercloud is that they've developed programs tailored to chronic physical health conditions. And so oftentimes when we are speaking with patients who we know have a chronic physical health condition and a mental health need as well, we're able to offer a program that's directly tailored for their diabetes or for their chronic pain, and we can reframe it in a way where it's something that will help them, manage the stress and the pain associated with that. And what that does is it's sort of the front door into mental health care, where now all of a sudden a patient who might still need face-to-face therapy all of a sudden is easing their own way into breaking their individual stigma, even in their own head, of understanding what mental health care is, the benefits of it. And so I think that's, of course, in addition to also just being a convenient option where a patient can access anywhere, anytime, there are ways where digital tools can also be means to breaking down stigma, even at the individual level.
Got it. Thank you for adding that, Carissa. I'm going to pivot. I see a question that just came in from the audience. So Lindsay's asking, what is the inclusion-exclusion criteria to determine if someone is appropriate for Silvercloud or not? Is it severity based on the PHQ-9 or type of mental health issue that they are tackling, for example, schizophrenia versus anxiety?
Great question. So what we do with the Silvercloud platform is, so we have about 290 plus organizations, about 300 plus organizations using the platform today. What we do is we get the platform to mirror that healthcare organization's care protocols. So it comes in, it does not come in as a system or a technology that tells, okay, now this is now how you do behavioral health. So as a result, what we will do is we'll mirror their care protocols. The most typical method or mode would be exclusion criteria would be with outside a band in terms of the PHQ-9. So for those who may not be familiar, PHQ-9 is a standardized global measure essentially at this stage used to measure depression scores. With sort of, minimal, mild, moderate, moderately severe, and severe in terms of those categorizations all the way up the acuity spectrum. So what we will see is organizations say we would like to exclude either the higher end of severe or all of the severe categorization, or indeed, again, for those who are not familiar, so the PHQ-9 is a 9-question questionnaire, which asks you about your framing over the past 2 weeks. And question number 9 on it is a question which can often be considered a trigger for suicidal ideation. And it's essentially asking, if I paraphrase, essentially asking around, over the past 2 weeks, have you thought the world would be better without you, and or self-harm? And a lot of organizations are concerned about that question causing clinical risk. So what we do is we'll offer them multiple pathways to that point, which is you can block a user at that point, but you will lose anywhere between 8 and 12% of a population, or maybe it's 4 to 6%, depending on the type of severity of the population you're delivering it with. Or you ask 4 follow-up questions on the Columbia Suicide Scale, which is actually asking them, is there any intent around suicidal ideation? So the great thing, again, about technology and the ability to be able to ask those questions and triage, screen, and assess allows you to be able to make sure you deliver the right and appropriate program. So we'll also deliver for a user who's on the far lower end of the spectrum of acuity, resilience, life skills, stress management programs, versus somebody who's requiring or needs challenges around bipolar self-management or depression, for example. What we don't do is give a happiness or a joyful program to somebody who is depressed, and likewise in reverse as well, because you just end up with low engagement and high dropout.
Thank you, Ken, for answering that question. So, Carissa, you kind of alluded to this or hinted at this at the beginning of the event. What are some of the ways that Quartet and Silvercloud have been partnering together? I saw that you all had a Care for Caregivers partnership. So can you speak to that and any other partnerships that you all have been working on?
Yeah, no, absolutely. We are excited to be partnered with Silvercloud. I would say our conversation started probably a year ago in earnest, when we were really seeking out to find best in class, high quality digital care options for our patients. And so for maybe, let's say 9 months, we did a lot of due diligence. We asked their teams lots of questions. And then we actually provided Silvercloud to our patients to see, how they liked it, how they were doing clinically. And so in gathering all of that information, that data, quantitative, qualitative, evaluating it from their product from a user design standpoint, we continue to be throughout very excited about who they are. And so given just their strong backing in clinical excellence, we have decided to make this available to Quartet patients. And so right now, Silvercloud is very much a wonderful care option for Quartet patients while waiting for in-person care or in parallel with finding some type of mental health service as well. So that's kind of current state going on in the background right now, which is incredible timing because this was available for patients as COVID was emerging in the US. But then the campaign that you mentioned is something that was really special and a great, again, sign of just of hope in such a tougher time. So when COVID was starting, as I mentioned, I live in New York City, and at 7 o'clock every day, everyone goes out and cheers for the essential workers. And whenever I'm on my balcony, I am thinking about our healthcare workers, and clapping is one thing, but, Quartet started a conversation with Silvercloud pretty early on of what else can we be doing for these frontline workers who are caring for patients, risking their lives every day, or, spending hours with patients with heightened, both on the physical health side and mental health side, but struggling with their own mental health as well. Just experiencing care delivery environments now that are uncertain, resource constrained, traumatic in many ways. And so we partnered together to offer a free offering to providers using Quartet services to help them with stress, sleep, resilience, program Silvercloud developed just for this COVID-19 period. And so that was a really wonderful thing for both of our organizations to kind of, in a very mission aligned way, put our heads together on and get out very quickly. I think we were able to release that probably in early April. And it's something that our providers can still access now. So
awesome.
Yeah.
It's great you both are partnering, both amazing companies and joining forces. It's awesome. So this question is actually, the next question is actually going to be for both of you. How have things changed for your respective businesses since the coronavirus pandemic? And in your view, what do you think the impact of COVID-19, this pandemic, will have on the future of tech-enabled mental health companies?
Question. Ken, do you want to kick us off?
Yeah, happy to. I think kind of we both kind of covered a little bit of this or tipped on a little bit of it. Mm-hmm. I think it's really, we've seen kind of other markets, say, for example, the United Kingdom, they've embraced digital delivery of cognitive behavioral therapy, digital delivery of mental health care for a number of years, and they were kind of spearheaded worldwide. And it took them kind of a 15-year span, really. When I look at that span of over 15 years to do what they did, the US over the last number of months has probably made an equivalent journey in probably 4 or 5 years in the course of less in terms of months. As a push and pull, both in terms of need, demand, shortage of therapist support, avenues, but also the reality for people in terms of getting access to care and requesting access to care. You can see why the percentages between 30 and 50% of people not making that first appointment, because it's 4 Tuesdays from next Tuesday at 2 o'clock. Can you go and see this person? Well, yeah, but what about the kids? What about work? What about this? And it just so much challenge that is there. You then add the backdrop that we're living in right now, it exacerbates it even more. So as a result, COVID-19 has accelerated the need, the want, the demand, and the reality of what virtual delivery of care can achieve. We're kind of proud to have been, partnered with Quartet and proud to be kind of part of the solution, I suppose, part of the access of care. We offered out the platform as a response to around 180 million lives around the world, including, the NHS workforce in the UK, which is about, which I think is the third or fourth largest workforce in the world. Again, to offer out not just to that person, but also the caregivers around them. So spouses, family members who are, I've heard stories of healthcare workers whereby, the husband, the wife, boyfriend or girlfriend or partner is working in the healthcare field, and they have to live in the basement separated from the other part of the family, eat different food and not to see each other for, multiple weeks at a time. It's very, very challenging. When we look then wider, watching a movie on Netflix with my wife, it's, you see a scene in a bar, in a restaurant, or at a game, and you see people close together. And automatically now in my own mind, I'm like, whoa, that's wrong. There is going to be a long-term psychological impact from what we have gone through right now. If there is an additional reemergence or a second peak or a second wave or whatever the term might be, that will prolong the challenges that we have. We're now exacerbating it with unemployment rates. We're working with a number of big state organizations to help around unemployed. It's created a huge acceleration in terms of need and demand, but also created a huge acceleration in terms of need and demand at the same time. There's no way of tackling the mental health challenges of today or in the future without very heavily leveraging technology.
Yeah, no, absolutely. I think, as you mentioned, like prolonged impact, I just looked up a few things to remind myself, when COVID was beginning to hit, my team started looking into what can we learn from past pandemics, of course, not being, the best equivalent, but we were seeing studies where, 1 year out of the SARS outbreak, 64% of survivors showed levels of depression, anxiety, post-traumatic symptoms. Even after Ebola, 3 years after the outbreak, 66% had PTSD, 53% had depression, 37% had anxiety. And so, of course, we didn't even need to look that up to know and to see what's happening now, which is, of course, a lot of people have cited the McKinsey report recently with 63% of Americans, reporting feeling anxious or depressed in the past, week. And so it's certainly here. The mental health pandemic has arrived, and I think we're very much experiencing, well, what happens when we go into this virtual world? And when you take the therapeutic area, mental health, the whole space, which has been very ingrained in a face-to-face in-person model, and you convert it overnight, what you realize is many who were slow tech adopters had no choice. Right, you had to move to this tele world, and so Quartet, knowing early on that this was going to be pretty serious, we thank our chief medical officer, who is one of the few infectious disease specialists in the nation. So he knew that this was where this was going, and so early on we had made some decisions around our digital care options to expand access to care. So whether that's telehealth, CCBT, supporting our mental health providers. And one of the decisions that we made early on to kind of keep patients front of mind for us is that we only match patients to mental health providers that offer teleservices, just to begin with. So even early on, before the whole nation went into shelter in place, because we wanted patients to feel that they had that option, that they could stay home and be able to meet with their provider in that way. And I think what we're noticing is that people prefer it. They are in the comforts of their home. There is something stigma reducing about it, of just feeling like they can be in their own space, not have to travel out. And so you take this modality of care where you don't need to have blood drawn or be poked and prodded. You can create this relationship virtually. And so we do expect to see many patients preferring this option, even when the country begins to open up again. I think some of the challenges that we'll need to keep an eye on, though, are the policies and regulation that have really enabled this type of transformation to occur during the emergency response. So providers being able to practice across states, prescribers being able to prescribe, without seeing patients in person first. So our hope is that many of these will stay in place, but I do think that regardless, patients are going to be a big role in voicing change at the payer level, just to now that they've kind of tasted and seen a version of care that they prefer, we certainly expect that I think just to answer your question from a different angle in terms of, how did Quartet respond to the pandemic as well? I also just want to mention from like a company perspective, Ken mentioned, some of what he's done at Silvercloud as well. We wanted to make sure that we moved everyone remote and just continue to create dialogue in space where people could be vocal about their questions. We have all hands meetings like once a week where it's just kind of a free for all, for people to express concerns or questions, as well as what I appreciate Quartet really caring for employees as well. So Silvercloud provided free access to all of our employees. And we also have, reimbursement for teletherapy visits ourselves. So kind of, again, this mix of caring for patients, caring for our mental health providers who are trying to, become teleproviders overnight and really equipping them with teleplatforms and help around that, as well as caring for our people and our employees too.
So that's amazing. Thank you for that, Carissa. So I actually want to ask you a question, Carissa, again about, you mentioned that personalized or like that patient matching to a provider. So I know in the mental health space, this word of cultural competency is a big buzzword. And so I'm curious to know, like, what is that matching process for Quartet? If a patient has a preference to see a provider who may be of a similar cultural background, does Quartet offer that as a part of the process?
Yeah, no, that's a great question. I think one of the early, I don't want to call it a mistake, but I think we'd like to embrace our mistakes in over time, is that we try to bring technology to totally disrupt the space, and said, we're going to have algorithms in place that's just going to match patients perfectly, and it'll solve it. The technology alone is going to get patients the care they need. And something that we realized over time is, so much of healthcare is about meeting people where they are and having a service component to it. And so especially with David Wenberg at the helm, he really invested in our care navigation team. And so our patients have a personalized care navigator with them. So when we, again, take the burden off them, match them with a provider where we are taking into consideration certain preferences, gender, location, things like that. If the patient is does not feel like they've built that therapeutic alliance or they don't have that relationship there, they have a real human whom they've been in touch with to contact again and say, hey, this doesn't feel like it's working out. Do you mind finding another match? And then we're off to the races to find them a new provider. So I think what's nice is we do factor some of that in, but we know that it's not always just an algorithm that can get you that right mix. And so we have the human component too.
Got it. It's helpful to know. All right. So my next question, Ken, I want to throw this one at you. How would you advise providers, payers, and investors to kind of separate the wheat from the chaff and identify actually effective solutions? Because there are lots of apps, lots of digital solutions. What are the real solutions? How do you make that determination?
Well, if I include Silvercloud in that list, I'm if I include it in, I'm going to look terrible. If I exclude it, I'm going to look even worse. I think, on a galloping horse going past this, it looks like a very crowded space. And that's what some investors have said. I know one of the polls is a question around that. It truly isn't when you actually look at what it is. It's like saying the automotive space is a very crowded space. Certainly it is when you break down organizations who do tooling, machining, design, professional services, customization, creating headlights, seats, seat covers, whatever it might be. But when you actually ask the question, how many organizations worldwide are building world-class cars and vehicles? It's a very, very small and very tight list. What we have seen is a proliferation of apps, tools, point solutions, and payers, providers, corporates, those organizations, they don't want that. They don't want just a mindfulness solution, because their members, employees, patients don't want just a mindfulness solution. They want something that is more heavyweight, less generic, and ability to be able to scale with that user as they go along that journey, that pathway to recovery. And that's very important. So I think that's kind of the first point and reference. So, at Silvercloud, we deliver across screening and monitoring, virtual therapy and counseling, self-management tools, and working with the likes of Quartet, we're able to offer then escalation from there. So it becomes end-to-end. We work together essentially as a virtual healthcare organization, virtual health system that partners with you as a partner or a payer organization. So you never lose contact, you never lose access to that patient. That's important. If I look then at kind of, for us, we created an assessment framework when we're talking to payers and providers. And that assessment framework kind of broke it down into 7 areas, which were 7 kind of almost like a reverse RFI or reverse RFP, which were asking questions around, number 1 for us is outcomes, end of. Doesn't matter where the argument starts or stops, outcomes are the key. If you're not delivering outcomes, you're really looking for something other than what Silvercloud offers. Outcomes in terms of clinical grade, not just an abstract survey afterwards saying, do you feel this helped you, yes or no? You need to be able to use the gold standard that was or is there now, which is face-to-face therapy, use the same clinical measures that it is. So we kind of say in Silvercloud, we go face-to-face, we go head-to-head with kind of status quo versus measuring against other digital interventions. So outcomes is key for me. Outcomes of engagement and clinical change. Privacy, data, and security are vitally important, and the emphasis the organization puts towards those. Thankfully, we haven't had any breaches within our industry as of yet, but we are a big proponent of why that is so vitally important. Integration, integrating within the EMR, the billing engines, the case management systems. This should not change your care delivery method. This should enable and open up multiple pathways, and that's the purpose and point of it. All the way through to patient satisfaction, usability, acceptability, clinician usability and acceptability, completeness of offering from all the acuity levels up. Because again, no organization wants to be dealing with a point solution anymore. They want full spectrum care and delivery because they want to do one audit, one clinical assessment, one financial assessment on an organization as they go and make those decisions. And then how transparent are they with their data? We provide an organization with a web-based dashboard that they can see and have full visibility on, which will tell them satisfaction scores, utilization, content ingestion, access times, clinical pre-post, T-test, Delta test, all that great information. And also then raw access to data they can then take and manipulate through their own systems as well to really dive in and work out what's working well. And we'll work with them on it as well. If you provide somebody with that end-to-end, I think you have now provided a real credible, not just alternative, but a real credible first port of call. And that's what we want to be.
I can affirm that is true, that at any time right now, I can log into our portal and see that snapshot of patients. And I think that is a very unique differentiator of Silvercloud, which we appreciate, is that they're very transparent with their data and the data speaks for themselves. They aren't sending you like a quarterly report where you're not really sure who's being included and, like how they're kind of defining things. I can at any time, see myself how our patients are doing. And yeah, I think that plus the outcomes, the published research, all of that is huge.
Awesome. Thank you for that qualifying statement there, Carissa.
Little fact check.
I think that was a strong plug for Silvercloud.
Thank you, Carissa.
So actually, Carissa, this next question is for you. How do you think that the move or the push to move towards more value-based payment models will impact behavioral and mental health services and particularly startups in the future moving forward?
Yeah, drastically. Right now, as many of us know, there is no standard of quality mental health care right now. I think that value-based care is such a buzzword. You can find articles and plenty of panels, on BBC, but you double click into that and it's all for physical health care. Mm-hmm. And I think it speaks a lot to that dynamic that I was describing, 30 years ago when you really carved out these benefits. And so health plans don't even have a starting place of knowing that they don't know who their providers are, if they're active. We'll start with that, and so I would say right now, we're not there yet, but we are moving towards it and it will have transformative, impact on the space. most recently, Quartet announced a partnership with Blue Cross Blue Shield of North Carolina, where they rolled out the first, payment model for behavioral health care. And I do think that that is a way that's going to transform care, which is aligning incentives and saying that we want to acknowledge quality care when that's provided, in very real metrics, even things like acceptance of care, scheduling appointments, conducting assessments, patient satisfaction, all of that. But right now, it's interesting because you actually got a dynamic where it's a little bit easier for digital care companies to show that. As Ken mentioned, like they've got that information. So I would say, if anything, digital is going to lead the way probably in being able to measure outcomes, and it's going to be the rest of the space that's going to catch up. And so I think what you're going to have to do is, well, what we're going to be doing is working with health plans to understand how you have value-based payment for digital and face-to-face care. So how you measure the quality of mental health care being delivered within their own network, as well as, as they begin to establish partnerships with digital care companies directly too, being able to set that up and set those expectations that, over time there will be these standards because they expect quality care for their patients. And I think raising that bar is just going to benefit patients. With them being our North Star, the reason why we do this is because we want to ensure that they're getting quality care. And so I think that's it. There's a lot of positive indicators that's coming for patients soon.
Thank you. Ken, did you have something to add there?
No, I just reaffirm, agree exactly what Carissa said. It becomes a great leveler of everything when you step outside the fee-for-service world, because it really allows digital delivery really shine, because it's, and one of those 7 on that kind of reverse RFI that I was referring to is scale. And scalability, the ability to be able to, the digital technology, be able to deliver at scale and provide an increased access. If you're not doing that, essentially all you're providing is kind of a kind of remote working service, which absolutely in rural areas or in theaters of war can be very helpful. But in terms of delivery on a large scale basis, you need to be able to provide something that can provide something at much better access and scale. So value-based care is the great leveler of all that's there, because it incentivizes the right type, form, and shape of behavior. It also shows and enables mental health to be part of the conversation of pre and post-surgical delivery, workforce within a health system or a healthcare provider. It's every part. It allows mental health to be part and every part of healthcare delivery, which I firmly believe it will and should be, because it's medication adherence, it's treatment adherence and treatment compliance as well. And that's healthcare utilization at the end of the day as well. So value-based care, yeah, I would be a big fan of where it can take us.
Awesome. Thank you for that, Ken. So we're winding down, but I have just a couple of more questions, and then I'll let you know when I actually have the very last question. But Ken, this question is for you. I'm giving you the mic again. So I know you have strategic investors. So I want to know, like, what has been the value to having strategic investors as your investors as a mental health company? Can you speak to that experience?
Yeah, certainly, and 2 of them are part of the people online here, so they both sat up in the chair. I'm sure. We, and I can see one of my colleagues, Kevin's on the line as well, CFO and COO. We went out as part of our investment round to source investment to accelerate the push and the drive of the business, and we wanted that investment to be really smart capital, really smart investment. And a strategic round in the true sense of it. Really proud of the organizations that have come together, the shape, the size, and the type of people, and the organizations that they're attached with and associated with. Some of those organizations have been customers of ours since 2016, 2017. So they've tried it, they delivered it, they've utilized it, and they've essentially invested because they said, we see what this can deliver to a patient in the US and North America and internationally. So what they provide is smarts, access, contacts, knowledge that you would not find in other forms or types of investment organization vehicles because they just don't exist. And really, when you're delivering what we're delivering, those things are just vitally important for us. So yeah, couldn't be happier, couldn't be prouder of the investors we have.
Awesome. Thank you for sharing on that. All right. So my second to last question is, what's the biggest thing that you think we get wrong about digital health writ large, and then specifically with mental health? And yeah, I know that's like a pondering question.
It is a pondering question. I think for me, the biggest thing that we get wrong around mental health, digital mental health, is that it's only acceptable to younger people. It's only acceptable to a cohort which is within a very narrow band of acuity. So we have this, one of the team members put together this amazing heat map, which is basically a spread of all of our users, so 400,000+ users, what their starting PHQ-9 and their GAD levels. So GAD-7 is a standardized measure for anxiety. So what, on a cross-section, what the starting levels were across that entire population spread across the acuity spectrum, pre and indeed post, across all of our programs and the range that we have. It's hugely interesting to see, and it dispels that myth first, which is this is only suitable for minimal levels or even mild, that Silvercloud has been deployed by those organizations right the way across that care spectrum, right the way across the acuity level, through to the challenge of, well, this is only for 26 to 34-year-olds, or other kind of, I suppose, myths. The highest recovery rate on our platform is 65 years of age plus. And when we show that stat and that data, that we can break it down by that information, it kind of finishes that argument. And people would say, well, why is that, or how is that? And we've spent some time looking at that, and we see patterns of delivery. So one of them will be the older population. Older population will interact with the platform typically once a week, typically a Friday morning, typically 10 o'clock, and typically an iPad device. Younger population will access it 7 times per week, 5 minutes at a time on 4 different devices. And it kind of, it brings us all back to how we interact with different things around us. So it's more occasion for certain cohorts. And you need to be able to deliver for those types of people for when and where they are right now. So that's one of the big myths that I Love Digital has been able to dispel. It's not for a niche. It's not for a small, it's not for just a certain cohort. It's for everyone. And that's the beauty of digital delivery. And digital mental health delivery, we can deliver it to everyone at huge scale.
Yes, got it. That was also something that I was going to say is usually like counterintuitive about digital mental health, and we're seeing the same in our patients as well. I think the other, just to add on to that, is that there continues to be this challenge around viewing digital health or digital mental health specifically as for milder or like kind of second class, almost, it's like, oh, face-to-face first. But I think something that we are oftentimes vastly undermining is the importance of patient agency and choice. And I think with mental health care, we've seen so much of the efficacy involved in mental health is really patient engagement, their desire to lean into this. And so there might be different times and different seasons why digital health and these tools are preferred by them. And that ownership involved in that journey is going to be much more effective than therapy at a given season. So I think it's us also beginning to show more nuance around a patient journey, and that it's not just one thing is the best for across all seasons. There are a lot of other factors of life that kind of impact what treatment is the most effective. So without that,
thank you so much for that. All right, so I think that this is a great note to start to wrap things up on. We have about 1 minute, 2 minutes left. So just one last rapid fire question. What's the one thing that you think any behavioral or mental health company needs to be prepared for, especially if they want to be venture backed?
I would say results, outcomes. I would say outcomes impact results in terms of delivery. I think that's That will be the new battleground, if you will. I think clinical trials and clinical papers were probably 12, 18 months and have been the last. I think the next wave will be based on clinical results and indeed proven ROI as a metric, that this is enabling us to be able to deliver at greater scale, reduce costs, or deliver better outcomes, but at a reduced cost. So that will be the biggest thing I would say to focus on. Make sure it works.
I completely agree. So I'll kind of take my answer that yes, and take it from a different angle, which would be to say, for an early stage company trying to get into the mental health space now, I would say you're going to be tempted to try to solve everything. The problem, as soon as you try to solve one problem, you'll find 10 more, and it'll really balloon. And so one thing that I would say is, be prepared to make partnerships. Granted, I'm biased because that's my role, but I really believe you don't have to solve everything. Many of us share the same vision. We have complementary capabilities. And so I think being able to demonstrate that you can work within the space and you're not trying to, do this all on your own, that humility, I think, is actually going to go a long way as a leading indicator of your success.
Yeah, and I think we're step 26 of a marathon journey. This is very early into digital delivery, so I would mirror the partnership mentality.
Awesome. Thank you both Carissa and Ken for this great discussion. This has been amazing. And thank you to our attendees for tuning in and engaging. I just want to remind everyone that this event was recorded, and immediately after we end the session, you can go back and watch the replay. You can also share a link with your colleagues, and they can watch the replay as well once they register. And we'll be hosting more events like this. So if you are interested in staying tuned, follow the Junto Health LinkedIn page, and you'll stay up to date on future webinars and virtual events that we'll be hosting. Again, thank you, Ken and Carissa, and I hope you enjoy the rest of your day and enjoy your weekend.
Thanks
Bye.
so much, Ashley. Bye, everyone.
Thanks, everyone. Have a good weekend.